GHK-Cu. What is that? Well, today I'm talking with Dr. Neil Paulvin, a very well-respected Manhattan functional medicine doctor. GHK-Cu. What is it? How do you use it? What are the benefits? Bodybuilding. Is it going to help you recover? How much of it should you take? That and so much more in today's episode. You ready for it? Let's dive in. All right, Dr. Paulvin, another one of these peptides with some strange names and initials, GHK-Cu. It's being used for a lot of different things and even in bodybuilding now. But what is this?
Yeah, I mean, GHK copper is a natural, C is the element abbreviation for it, is a natural occurring peptide that we have in our body in the skin, hair, muscle, tissue, ligament. And what we're trying to do, people are trying to do now, pretty much to heal a lot of different things, like you said, is they're using it in, I think, every form known to mankind, from cream to pill to injection, to try to help, again, for healing purposes, where it helps to again adds more of those proteins to the system to help regenerate cartilage and tendon. It's really good in boosting collagen. It's in the skin to begin with. That's why a lot of these skin creams are now putting it in there. It's actually good for hair growth potentially, so people are using it as a foam or an injection. So it's used being that healing capability, as well as that collagen boosting capability, has a lot of great uses throughout the body, which is why a lot of people are taking collagen now in general. But that's kind of what down the pathway that it's going.
Yeah, and people taking collagen wanted to actually take it right before your workout, so it's actually in your bloodstream, which helps. There's a little side note. I had to put that in there. So when people are taking this, injection or creams, one is the injection when they take it, is that going to help them aesthetically as well, or is that more like an internal or fixing tissue? Because to me, it might make sense that it's going to help your face and maybe wrinkles or anything, but obviously they're putting it into creams as well.
There's creams and foam. So cream for the face. So if you're doing an injection, if you're doing what we call a subcutaneous injection in your belly as an injectable peptide, you're not going to see it. It's not very limited local reaction. You're not going to see low wrinkles, or I have patients ask me, are my sag lines or my fat rolls going to go away at that spot? No, it doesn't work that way. There's other stuff for that. But if you use it in a foam or a cream on the face, you will see that if you do that, especially if you augment it with things like red light or other creams that are out there, as now NAD cream that helps. Yes, you will see, as over a pretty short period of time, some collagen boosting in there. The hair is the same thing, but but otherwise, injection wise, you feel it. Like, again, you may feel less inflammation. Like, I have patients who get it like in their shoulder as an injection, like you would do like an old school cortisone injection, the pain will go away, but it doesn't, like, wow, my shoulder has more muscle or anything.
Right. Okay. And so how is this helping with people that are using for bodybuilding, just for tissue repair, or is there some sort
Exactly.
of, there's no anabolic property?
Very, very limited. There's so many other peptides out there now for muscle weightlifting and bodybuilding. This is for recovery. So you can go out and you're limiting the damage on those joints. So instead of me having to take an extra day off, you can go back and do the same body part, or that's why you're doing it in terms of your workout routine. But in terms of actually being anabolic, it's not anabolic.
Okay. What about the usage? I mean, is this a daily injectable? If you're using it as the traditional peptide, is it a daily?
Yeah,
a couple of days a week?
It should be done usually daily.
Okay.
Usually daily for a couple months.
All right.
Either by itself or
cycle off of it too, because I know some peptides you cycle off and on. Is this one of those ones that you need to kind of do that too?
I guess the answer would be yes. I mean, the way I explain these types of peptides that are for recovery, it's kind of like Motrin or something like that. Meaning, what I mean by that is you kind of know when you need it. So yeah, you're going to come off it. I'm a little more cautious. I'll tell patients you come off of it for 2 or 3 months. There's a lot of other things you can switch on and off to. So I'll have them come off for 2 or 3 months. And if you say, I feel the same as I did on it, then you don't need it for a while. And then you may go to the gym and irritate your shoulder again, or it's just not, you're feeling a little bit more resistance when you do it. Yeah, okay, it's time for me to call Paulvin and start my GHK routine again. So a lot of my patients, at least, and it's pretty, you'll know when you need it. It's not something that you're just going to continuously do for body, I mean, there's people who do it more continuously for face or cosmetic reasons
Okay.
than for in the muscle building type scenario.
Okay. Now, if somebody is, that's kind of an personal question too. So, if you're taking the peptide injectable form, could you take that and put it into like face moisturizing cream, or is it not enough dose?
Um, People do it. It's not going to work as well because it's not absorbing. It's going to kind of leak. You're not going to get enough in there.
Yeah.
The foams and the creams are made so it absorbs in. It's actually in there, and it's going to absorb directly into your skin. It'd be like just taking the needle. It's kind of like, have you people ever had a vampire facelift? It's just kind of like taking the syringe and spraying it on your face. It's not going to help a little bit, but
Okay.
you're wasting money. That you're better off just getting the foam.
Okay. And then, so as far as the foam, is that a prescription? Some people find that online.
Well, this is my little pet peeve, but yeah, I mean, technically, with peptides in general now, there's really either you're going to get it from a compound pharmacy,
Mm-hmm.
which is regulated by the government, and we know it's in there most of the time, and then you can get the wild wild west, which every company is just saying it's not regulated. They've tested some of these things where either it's not in there or it's not the dose they say is in there. It comes from overseas. It's just kind of buyer beware.
Yeah.
So there's two levels of it. It's probably maybe half the price or 2/3 of the price. So you got to weigh those options, understand you don't know what you're getting versus knowing what you're getting, and then paying the price one way or the other.
Yeah. There's a
But you
lot
can,
of research based only websites, which some that say they're third party tested, but I get a lot of questions, especially on this channel. And I would say, go to your doctor, go to your doctor,
yeah, yeah. I mean, and there's a couple. Yeah, you really. I mean, I heard something yesterday where they studied a lot of these things, and it's like, it's not what it is. So, I mean, you got to understand, it happens like even with melatonin, it's not what it is. So if that's what's happening with melatonin, which is like $2. This stuff is much more expensive. They're not. I'd be very cautious.
Okay, cool. And side effects at all with this?
Not really. I mean, I haven't. This is probably the least side effect. It's a night. It's I really see. It's really just again just any side effect you can get from any injection. You could be sore, redness. Well, you could technically have a reaction to it. I
Yeah.
mean, I've never really seen a really major reaction to GHK. So not this one again is probably one of the more benign peptides out there
All
in
right.
terms of side effects.
Dr. Paulvin, where can people find you?
Sure. People can find me at my website, doctor spelled out paulvin.com, or my Instagram, which is drpaulvin.
All right, cool. Well, we talked about peeing blue, so people need to check out that video. And now you're gonna try to make me prettier as well. So I need to contact you to get some face cream.